Another evolution in multiple myeloma, I come from Little Rock, Arkansas, having worked with Bart Balagi when we started the total therapy approach, which included induction therapy, we used transplantation, and then we always had maintenance strategy too. It is kind of interesting for me that the whole world is coming to the same kind of conclusion, that myeloma is not something you can treat like lymphoma, 6 cycles of treatment like in a Hodgkin disease, or in a non-Hodgkin lymphoma giving 6 cycles of CHOP or something like that. It looks like you have to have an induction therapy. If the patient is someone who's slated to get high-dose therapy and stem cell transplant, they go through the stem cell transplant. And then there is also maintenance therapy. And those patients who are not going through stem cell transplant, those patients also now it is clearly shown that prolonging and continuing the maintenance therapy is beneficial. There have been several large randomized trials. The one that comes to mind right away is in the elderly patient population, non-transplant eligible, is the study where you had melphalan-prednisone, then melphalan-prednisone lenalidomide, both given for a fixed duration of about 9 months, and then melphalan-prednisone lenalidomide followed by lenalidomide maintenance. The patients who were on continuous therapy had much better progression-free survival. When lenalidomide and dexamethasone had been used, like in the first trial, you have lenalidomide dexamethasone with continuous lenalidomide dexamethasone as opposed to lenalidomide dexamethasone for a fixed duration of treatment, or melphalan-prednisone for a fixed duration of treatment. You find that giving lenalidomide dexamethasone continuously with continuous lenalidomide has a much better outcome. All of them shows that the progression-free survival is dramatically improved almost by 18 months when you use the lenalidomide continuously. So I believe that maintenance therapy plays an important role. What about after transplantation? So there were 2 large randomized trials were conducted. One is the ECOG trial, which was done in the USA, and then there was a trial in the France, the IFM trial. The USA trial showed that if you did stem cell transplant, whatever the induction was, and you stopped there, the median duration of controlling the cancer, or PFS, is about 2 years. But if you give them lenalidomide maintenance, you can improve the PFS by an additional 1.5 years. So now you have 3.5 years of control of cancer. And in the US trial, this showed that it actually gives you a survival advantage. In the IFM trial, there was improvement in progression-free survival, equivalent to what was seen in the ECOG or the US trial, but there has not been an overall survival advantage shown to date. While that may be true, my philosophy at the bedside of managing patients is, if I can keep the cancer away as long as possible, especially in the United States, there are newer and newer drugs coming. So even if they relapse, there will be a new paradigm for their management of their clinical trial. And this is especially true right now. As you know, in relapse situation, we had the results of the ASPIRE trial, which was positive. Then we have the ELOQUENT trial where the elotuzumab is included with, and that is positive for improvement in progression-free survival. We have panobinostat results, which was presented in the last ASCO. That was positive. And now we have the ixazomib trial, which is tourmaline trial in relapse situation. That is also positive. So all these positive trials hopefully will lead to the approval of these drugs. So, you will have new options for these patients. And then further along, you have anti-CD38 monoclonal antibody in the pipeline. So my feeling is taking care of the patient now, keeping them on maintenance, prolonging the progression-free survival, even if the overall survival is not necessarily improved in the follow-ups we have had so far, to me gives an edge to these patients so that when they relapse, they have newer treatment options available.